All right, go ahead.
Hi, my name is Kelsey Heidema, and I'm going to be presenting on epilepsy today. And my group members are Nikki Kuiper and Elise Caparis. So epilepsy is a disorder in which nerve cell activity in the brain is disturbed, causing seizures. Because epilepsy is caused by abnormal activity in the brain, seizures can affect any process your brain coordinates. So some symptoms that you might see in your loved one is temporary confusion, staring spells, uncontrollable jerking movements of both the arms and the legs, loss of consciousness, and then psychic symptoms such as fear, anxiety, or deja vu. Symptoms vary depending on the type of seizure, so most of the time the patient with epilepsy will tend to have the same type of seizure every time, so each episode will be the same. So in your loved one, you might probably see the same symptoms every single time they have a seizure. So before diagnosing your loved one, we'd like to go through some assessments first. And the first one that we look through is history. And so we're going to ask about the seizure phenomena, ask about any previous seizures that they have, ask about any strokes or epilepsy risk factors that they've had before this. We also want to look into any current meds that your loved one is on, just to make sure that they aren't predisposing the seizures. And then for the exam, we're going to look where the location of the seizures are and just figure out the severity of them as well. We're also going to look into the psychosocial part of it, and that's just because that seizures can be very debilitating. Seizure activity in public can be very embarrassing and poorly understood by the public. So that means that going out and attending work or school can just be a very serious trial for your loved one. And so we just want to consider their mental health as well. So for the causes, epilepsy has no identical cause in about half of the patients with this condition, and the other half, we may be able to trace the condition back to something such as genetic influence. So some types of epilepsy run in families, and so in that case, they might have a genetic influence. Also, it could be caused from head trauma, so if it's a result from a car accident or any other traumatic injury could cause that as well. We also want to look into brain conditions, so anything such as a brain tumor or a stroke in your loved one could be a possible cause. And stroke is actually the leading cause of epilepsy in adults older than adults older than 35. We also want to look into any infectious diseases, so things such as meningitis, AIDS, or viral encephalitis could also be a cause of epilepsy. We also want to look into any prenatal injury. So babies are very, very susceptible to brain damage while it's still in the womb. So things such as infection from the mother, poor nutrition, or oxygen deficiencies could also cause epilepsy. The last thing we want to look for is any developmental disorders such as autism. So to diagnose, we want to review the symptoms and medical history like I talked about earlier. And then the three things that we're going to be doing. First, the doctor is going to be taking your loved one for a neurological exam. So the doctor may test them for behavior, motor abilities, or mental function. The next thing we want to do is a blood test. And so take a blood sample just to check for signs of infection, genetic conditions, or other conditions that may be associated with the seizures. And then the last thing that we could do is take a test to determine the brain's abnormalities, so things such as an EEG, which is the most common test, or also a CT, MRI, or a PET scan. So for courses of treatment, there's several options for your loved one. One of the first ones is medication, and so with things called anti-epileptic medication, most patients can actually discontinue their meds after 2 years or more years of living and be able to live a seizure-free life. The next thing that they might be able to do if medication doesn't work is actually surgery. And so surgery will occur when meds fail to provide adequate control over the seizures. And doctors usually perform surgeries on patients who have seizures originating in a well-defined area of the brain, or if the surgery will not interfere with functions such as speech, language, motor function, vision, and hearing. The third approach that we could do is actually therapy, which is a really good alternative to both medication and surgery. And one of the things that we can do is a vagus nerve stimulation. So vagus nerve stimulation is when we implant a device called a vagus nerve stimulator, and it works as a pacemaker, sending bursts of electrical energy through the vagus nerve, and the seizures are usually reduced about 20 to 40%. Another thing that we can do is actually just the keto diet, and they've seen in some children that they've actually been able to reduce seizures just by following the high-fat, low-carb diet. The last thing that we could do for your loved one is deep brain stimulation, and that's when we implant electrodes into specific parts of the brain, and it's usually typically in the thalamus. And so we connect it to a generator implanted in either the chest or the skull, and it sends electrical pulses to the brain, and it can also reduce seizures. So unfortunately, it has been seen that there's an early mortality rate among individuals with epilepsy, especially those with the recurrent seizures. And in a population-based study, 24% of children with epilepsy die within the median 40-year follow-up period. So that's a rate of about 3 times the general population. However, mortality does decrease among individuals who are in 5-year remission. So like I said before, with a lot of the treatments, you can get into remission. And lastly, just some follow-up things for your loved one. We just want to tell them to maintain rest and adequate rest and nutrition, because that's super important. And also just to check with their doctor before any dieting occurs. Another thing to do is just report infections promptly, and to avoid any trigger factors such as flashing lights, hyperventilation, loud noises, video games, or TV. We also just want to have them keep up with any follow-up appointments. And lastly, it's just super important to lead as normal as life as possible. Here are those resources. Thank you guys for listening.